As part of our future note, I now invite Mr. Anupam Kaul, 1979 IITBHU alumnus, to introduce Ms. Mandakini Pawar, Head Healthcare Excellence, CII. Over to you, sir.
Yeah, good morning to everybody. Good afternoon to everyone. So let me introduce Mandakini Pawar. She is my colleague and leading the Healthcare Excellence Initiative in the CII. I think I'll leave it to Mandakini to talk a little more about the CII initiative. And I don't think I'll take more time because we are already hard pressed for time. Thank you very much. Go ahead, Mandakini. Thank you.
Thank you, sir, Anupam sir, for introducing. Good afternoon, everyone, and thank you for giving me this opportunity. Thanks to IITBHU for giving it such an honor to be a part of this August, webinar. So my topic is basically the CII Healthcare Excellence Journey, and definitely it talks about the future of healthcare. So this is about CII, India's premier business association, which was founded in 1895. And it's a non-government, not-for-profit, industry-led and industry-managed organization and plays a very proactive role in India's development process. We have around 9,000 members from the private as well as the public sectors, which of course includes the SMEs and the MNCs. We have an indirect membership of over 300,000 enterprises from around 265 national and the regional sectoral industry bodies. We have total around 65 offices all over India, and out of which 10 centers of excellences are there in India and 10 overseas offices. So it's a reference point basically for the Indian industry and the international business community. This is our CII Institute of Quality, which is in Bangalore, which is one of the center of excellence. And in fact, it is the first center of excellence on quality and a nodal and the reference point for quality and a pioneer for quality movement in India. We also are on some international quality boards like Japan Institute of Plant Maintenance, then JMA, the Union of Japanese Scientists and the Engineers, Association of Overseas Technical Scholarships, American Society of Quality, Singapore Standards, BSI Group, that's United Kingdom, European Foundation Quality Management, and the Baldrige Foundation as well, and the Global Excellence Model Council. So coming to the healthcare context, that yes, we all are aware of that it is one of the India's largest sector, both in terms of the revenue as well as in the employment. And the range of activities, of course, it includes a hospital, pharmaceuticals, medical devices, laboratory diagnostics, medical education, telemedicine, even the medical value travel, health insurance, and so on. The major segmentation is the government sector and the private sector. In the government sector, the basic healthcare facilities are in the form of PHCs, and there is a limited secondary and tertiary care institutions in the key cities. If you look at the private sector, there is a secondary, tertiary, and the quaternary care institutions with the major concentration is in the metros, that's in tier 1, tier 2 cities. If you look at the, yes, there is a great competitive advantage which we have because we have a very large pool of well-trained, skilled medical professionals. There is a significant cost arbitrage is there. The market size, if you look at it, hospital industry, currently we have around 61.7 billion US dollars, and in projected in 2022 is around 133 billion US dollars, which is growing at the rate of CAGR 16 to 17%. The medical value travel, India ranks around 14th in the global destination, and currently it is around 6 billion US dollars, but it is growing at the CAGR of 22 to 25%. Dr. Indubhushan also mentioned about the government spending, that's the GDP has grown from 1.2% of GDP in 2014 to 1.4% in 2018. And which is expected to rise to 2.5% by 2025. But there's a long way to go because the countries like Brazil is also have around 8% of GDP spent in healthcare. There is an increasing preference for availing medical treatment from the private sectors, and it has been seen that there is an increase in hospitalization in private facilities, both in rural as well as in urban areas, and marking a rise in preference of private, basically the setups. This is the census of medical value tourism. Like we get around, say from Bangladesh, it's around 22%, and Maldives is around 18%. Afghanistan, Iraq, we have around 8 to 9%, and Nigeria is around 6%. And if you look at the Sri Lanka, Oman, and the Russia, is around 3%, and UK and US, it's hardly 1 or 2%. So what are the concerns and the challenges today our industry is facing? We have increasing customer consciousness. There is a more fact-finding, low cost efficiencies, high hospital acquired infection rates. There is a disparity between the pricing and the quality, illegal and unethical practices, which is definitely, there is a trust erosion, which is impacting our credibility, lack of corporate culture, lack of business model innovation, lack of managerial skills. There is a less focus on the outcomes, very nascent use of IT and the data analytics, which is impacting our competitiveness. In terms of the workforce, there is a lack of skills. Besides the technicals, of course, there is a soft skill, motivation, and empathy. Lack of clear protocols, that's in terms of the processes, whether it is a clinical process or the non-clinical, and there is a high attrition rate in the sector. Another challenge which we have, there is a recent study has been done, and 110% rise in the number of medical negligence cases in India every year. And then 90% of all these cases in medical negligence involve the hospitals. So 60 to 66% of the filed cases are because of the hospitals not taking proper consent or because of the improper documentation, which is throughout the course of diagnosis and the treatment. So from the period 2008 to 2015, it has seen an exponential increase in the number of medical legal cases. So what are the different key metrics, which we track in our healthcare are like, hospital acquired infection, the medication errors, the patient turnaround time, the bed occupancy rates, even the LOS, that's the average length of stay. Then the utilization rates, that's in terms of the OT and ICU footfalls, and the revenue. But what we do not track, and which is a really major concern in our healthcare, and that is what is, if we want to make our healthcare sustainable, so we really need to look into these parameters. Like, for example, the leadership effectiveness, we do not really track whether our leadership is effective. Similarly, the return on investments in terms of, there are multiple things which have been manpower or the finance or the equipment and so on. Similarly, we do not track the effectiveness of our strategic planning process and the development. At the same time, we also do not track the employee engagement, employee productivity, the training effectiveness, even the segmented data in terms of the attritions, then the society perception scores, the customer loyalty, that's a net promotion score, environmental impact, that is like natural resources like water, waste and discharge, energy, and the carbon footprint. Similarly, there are a number of areas in which there is a huge waiting time, but we do not have the segmented data in terms of the waiting times. And similarly, in terms of the cost of maintenance, in terms of the equipment. So now coming to the excellence models, which the CII Healthcare Excellence Journey, which we started, we have these three models, which are worldwide, very well recognized and very well accepted. And these are the business excellence model, or you can call it as a performance excellence models, which is really a need of the hour for our industry to become globally competitive and sustainable. So the Malcolm Baldrige, it's an American award. The Deming is from Japan, and the European quality is basically called as the EFQM. So in manufacturing and in other service sector, we use the EFQM, and for healthcare and for education, we use the Malcolm Baldrige quality framework. Now, what are these? What are different business advantages which we get when we use these excellence models? So there is an enhanced customer satisfaction which goes up to minimum by 30 to 40%. It also has a strategic focus. The revenue and the profitability goes up to by 20%. The cost reduction is around 25 to 40%, and similarly, the reductions in the defects or the cost of poor quality is up to around 40%. The new services which you introduce, the revenue enhancement is up to around 30%, which is a development focus, and the supply chain effectiveness is up to by 40%, wherein we take care of the reduced inventory, lead times, and so on. Also, there is enhanced asset utilization. People satisfaction goes up to by 20%, and energy savings and the water conservation goes up to by 40%. And community engagement also impact has around up to 60%, which is a societal focus. Now, how does this healthcare management framework work? The Healthcare Excellence Framework, which empowers you and your organization to reach its goals, improve your results, and become more competitive. And it is an outcome focused, validated management model, which is based on the characteristics of the high performing organizations. So it is very much customized to the business context. It takes care of your internal stakeholders. It takes care of your connected stakeholders like distributors, shareholders, your customers, your other customers, suppliers, financiers, and retailers. So basically all the stakeholders and the shareholders. At the same time, it also is customized to the external stakeholders like government, press, or media, pressure groups, local communities, and the society. So this is basically the framework is it talks about the leadership triad, and the leadership triad talks about leadership, the strategy, and the customers, which emphasizes the importance of a leadership focus on strategy and customers. The organizational profile will talk about set the context for your organization, and it serves as a background for all what you do. The results triad will talk about your workforce, operations, and the results. And the results will basically is the composite of all your healthcare and the processes, customers, and the workforce leadership and governance, and your financial and the market results. It definitely, the basis of the healthcare criteria is a set of core values and the concept, which is embedded in the high performing organization, and the system foundation, which is the measurement, analysis, and the knowledge management, which is one of the most critical component of the excellence in healthcare. So, which is critical to effective management and to a fact-based, knowledge-driven, agile system for improving the performance and the competitiveness. So this is the roadmap which we have basically designed. And the vision is to make our Indian healthcare industry globally competitive and improve the sustainability of our organization. So there are various stages the healthcare organization can go in for. And the CII, we give the handholding in various capacities and capabilities. So these are basically our different initiatives which we have started in terms of trainings, in terms of assessment, in terms of the consulting. So there are various trainings which we provide to the healthcare professionals and the doctors. So we launched this Baldrige framework in 2018 September in our country, and there is a tremendous support and the response which we are getting from all the hospitals, not only from the metro cities, but even from the tier 2, tier 3, tier 4 cities as well. And the trainings which we are conducting and in terms of the capacity building are like on performance excellence training. Then there is healthcare executive trainings are there, data analytics, finance, healthcare finance. Similarly, there are multiple tools basically which we give training on, because these are tools which are very essential to implement the excellence framework in the healthcare organ. So these are various initiatives which we are basically dealing with. So we had also taken the international healthcare study mission to various hospitals in US. And these hospitals are like Hill Country Memorial Hospital, Herman Memorial Sugarland, and MD Anderson Cancer Center. These are Baldrige-Wiener hospitals, and therein we basically took the delegation to see the difference between what is the impact of excellence framework in terms of quality care to the patients and to the economy. So these are basically, I'll just quickly come to the slides. So in the leadership, we talk about how to share your vision and lead your organization. Strategy, of course, how to prepare the future, and then it will help you purpose answer 3 questions. Is your organization doing as well as it could? How do you know that? And what and how should your organization improve or change? So I won't go to the further slides because you're already running short of time. So just wanted to basically apprise you that how the excellence in the healthcare is a future of our Indian healthcare system, because it is based on various values and the concepts. And these are the core values which are very, very essential for our healthcare organization to become sustainable and globally competitive. And these values are like, it has to be a system perspective, there should be a learning and agility, focus on success. And also this, when we call about the success, it should be inclusive, it should be sustainable, it should be predictable, and it should be comprehensive. So with this note, would like to thank you so much for giving me this opportunity. Thank you. Thank you.
Thank you so much, Mandakini, for highlighting key metrics on healthcare, performance models, and the roadmap of healthcare. Thank you so much.
You're